Thank you, Chair. Let's talk about approval of paediatric COVID vaccines. The TGA approved the Moderna COVID paediatric vaccine on the 19th of July last year for children 6 months to 5 years. This was based, according to your website, on the results of the KidCove clinical trial run by Moderna in the USA and Canada. The approval was for all children, but ATAGI's guidance is the vaccine is recommended only for high-risk kids having one of a list of serious comorbidities. Is that correct?
I believe so, Senator. I'd have to check the current ATAGI guidance, though. I can take that one on notice.
Thank you. The KidCove clinical trial is listed on clinicaltrials.gov as, quote, a study to evaluate the effectiveness of Moderna's vaccine in healthy children aged 6 months to 12 years. Healthy children, on what basis did TGA authorise the use of a vaccine tested on healthy kids for use in Australia on high-risk kids with serious comorbidities?
Senator Roberts, I think what we've learnt throughout the pandemic is that the disease of COVID is most damaging to those with other comorbidities, and particularly people who have immune systems that don't work well. And so our recommendation, or the recommendation of ATAGI and the recommendation of the TGA, would have been to be able to support young children with precisely those conditions by demonstrating that the virus was safe and efficacious in a healthy population.
But the study was to evaluate effectiveness of Moderna's vaccine in healthy children, yet you approved it for children with comorbidities.
Again,
no basis.
Again, it's the sort of thing that can be extrapolated, and it was very important to be able to provide a protective therapy for young Australians who were at risk of serious illness from COVID-19.
So you just extended the study into a completely different field without testing?
Senator, you can't do the clinical trials in those. Those trials have to be done in healthy children. You wouldn't be able to, do that first in population trial in people with severe underlying diseases. You'd have to get healthy volunteers, and that is a good way of showing that but then the ATAGI advice is then considers all the other risks of COVID as well. So that the safety can be shown in healthy people, but then the ATAGI advice is relevant to the risk of severe COVID. So there's no disconnect there.
Your approval was in July 2021. That clinical trial finishes in November 2023. So it is not even finished yet. The TGA must have worked from interim documents. Did the TGA evaluate the patient-level data, or did you just take Moderna's word for it, like you took Pfizer's word for it?
Senator Nick Henderson, Acting First Assistant Secretary, Medicines Regulation Division. The Moderna vaccine was approved through the provisional pathway, which is a well-established pathway. It was an established pathway before the pandemic. That allows for approval based on interim clinical data, and data would be supplied on a rolling basis over a period of time. Did you evaluate the patient-level data before you approved it? Senator, I think we've answered questions in relation to patient-level data. The TGA, we do not require patient-level data. We do require clinical data that is of sufficient evidence from the sponsor of the vaccines.
So you relied on the sponsor of the vaccines?
We relied on a dossier provided by the sponsor with with clinical data provided.
So would this be misfeasance on the TGA?
Sorry, Senator, I'm not sure.
Let's move on. Quality of reports in the DANE. The DANE reports can come from medical practitioners and also the general public. How many of the reports of deaths from COVID vaccines recorded by DANE, came from members of the public, and how many from medical practitioners?
I don't have those exact numbers on me, Senator, but I can take it on notice.
Then why is the first question you ask when a person makes a report, are you a medical practitioner or a member of the public?
I guess it's to allow us to have as rich a data set as we can, Senator.
Why is the first question that way, though?
Senator, it allows the triaging of the subsequent questions
Right.
As you go through the form.
Just checking these reports, my staff have checked the reports, suggests there is a waiting room at the Dane database holding reports that have been made but not yet checked and registered, which seems logical. How many reports of COVID vaccine harm are waiting to be checked, and how many of those are reports of death or permanent injury, serious injury?
Again, Senator, I don't have those numbers on me, but I'll take that on notice.
Thank you. Were more reports to Dane made by states with mandatory adverse vaccine effect notifications, which I think is New South Wales, Queensland and Western Australia, which is only 62%, as against states without mandatory reporting of vaccine harm?
Sorry, Senator, could you
Was
repeat
there a
that?
higher proportion of reports of adverse events from states with mandatory adverse vaccine effect reporting notifications?
Again, Senator, I'll have to take that detailed question on
Thank you.
notice.
There is now a call for a vaccine safety office from an epidemiologist. I was going to go into that, but clearly he's calling for, he's pretty highly regarded, my understanding, he's calling for independence in the scrutiny. When we have a provisionally approved medication, surely that's all the more important to have a very strict reporting of adverse events.
We've got a very comprehensive and rigorous safety monitoring system at the TGA. We use a number of mechanisms to look for safety signals, as well as, talking to our international regulator colleagues and sharing information in relation to safety issues with the vaccines.
Have you done any testing on whether or not doctors and the public are, what percentage of them are reporting adverse events?
No, we haven't
No, okay.
done that study, but
Let's go on to the carcinogenicity of the vaccine. The European Medicines Agency, EMA, had 140-page assessment report for the Pfizer vaccine. On page 55 it says, quote, "No genotoxicity nor carcinogenicity studies have been provided," end of quote. Then it says the components of the vaccine are lipids and then RNA, which are not expected to have genotoxic potential. The carcinogenicity part of that statement was skated straight over, and I want to ask you about that. Did you receive any genotoxicity or carcinogenicity studies in support of the Pfizer application?
I do not believe we did, Senator.
No. The words carcinogenicity and cancer do not appear in your 42-page assessment report. Did you review the Pfizer product from the perspective of cancer?
I believe there was no need for that, Senator, but I'll take that on notice.
Okay. According to the data from the Australian Bureau of Statistics in their latest release of the provisional mortality statistics, which we know underrepresents deaths, this was from the head of the ABS the other night, he told us, by 15%, because it does not include autopsy-reported deaths, only doctor-reported. The figure for provisional mortality from cancer was as follows. Baseline average for January, February over the last 4 years, 3,637. January and February cancer deaths in 2023 was 3,803, plus 15%. And for 2021 it was 3,816. Both years are above trend. Remembering trend includes autopsy deaths and the provisional mortality figures do not. Yet the provisional mortality figures for cancer are above the past. So the problem is worse than these figures suggest. So let's review. We have injections that were approved without carcinogenicity testing. We now have a spike in cancer. Can you please show me where you have investigated this spike and ruled out it being from the COVID injections? Have you even considered that?
There's no evidence, Senator, that increase in cancer risk is vaccine associated. As Professor Langham said, there have been many billions of doses of these vaccines administered. If there were a significant association with cancer, I think the world international data would have shown it. There's no evidence that there's an association.
Liquid nanoparticles. The reference to lipid nanoparticles, in earlier conversations around COVID vaccines suggested the nanoparticles stayed near the injection site, then passed out of the body. Am I remembering them correctly?
Senator, that's correct, and we've dealt with this on a number of occasions on other questions on notice as well.
Thank you. Documents released in the Pfizergate court-ordered document dump showed that Pfizer knew at the time of seeking approval for their product that the lipid nanoparticles not only collected at the injection site, but significant concentrations were also recorded in the adrenal glands. From a table in the Pfizer test data, accumulate in the ovaries, the liver, the kidneys, the brain, they go all over the body. And the adrenal glands. Did you know at the time of the Pfizer application that lipid nanoparticles collected across the body?
Senator Roberts, what you're describing is a particular aspect of the preclinical studies by which an element of the lipid nanoparticles was labelled with a fluorescent label. And so what's seen in those studies is the fluorescent label and not necessarily the lipid nanoparticles.
Is it still your position then that this build-up does not have an adverse health effect?
Correct.
Why did former Minister Greg Hunt say the world, quote, "the world is engaged in the largest clinical vaccination trial"? Why did he say that as Health Minister?
I can't speak for Minister Hunt's comments, I'm sorry.
We've dealt with other agencies and employers who relied upon you as the TGA. They cite your advice for the basis of their policies, their decisions. CASA, Civil Aviation Safety Authority, Fair Work Commission, Fair Work Ombudsman, Department of Employment, Department of Employment and Workplace Relations, the Fair Work Commission Judiciary, the Home Affairs Department, the Agriculture, Fisheries and Forestry Department, the New South Wales Council for Civil Liberties, state and federal health ministers and Chief Medical Officer and the Chief Health Officer, all drove vaccine mandates. The National Cabinet cited you guys. Millions of people have been gutted based on this. Horrendous vaccine injuries. All pointing their finger at you. Does your board, do the members of the board of the TGA understand the concept of misfeasance in public office?
There is no board of the TGA. The TGA is a department of...
Do the heads of the TGA understand the concept of misfeasance?
Very, very much understand the concept of misfeasance, and we totally reject any suggestion that that has taken place. The TGA, I should point out, the TGA has never taken a position on vaccine mandates. The TGA's remit is to assess the safety and efficacy. Sorry?
Do you support them or not?
I think the Commonwealth Department has supported them in limited circumstances, particularly early on when transmission reduction was much more beneficial. We certainly supported them in aged care workers and aged care and disability workers. The Commonwealth Department has not taken a strong position on community-wide mandates, but some of the states and territory governments have taken a much stronger position.
Who advised, from your senior leadership position, who advised the former Prime Minister Scott Morrison to buy the injections at billions of dollars, to then give them to the states, to indemnify the states, to also then provide the health monitoring data so that vaccine mandates could be introduced? Who then, the state premiers then said that they mandated vaccines on the basis of the National Cabinet, which the Chief Medical Officer is associated with, I understand. Mm-hmm. And then we saw the former Prime Minister mandate vaccines in defence, the Australian Electoral Commission, aged care, and then we see the former Prime Minister said repeatedly, daily, for 2 weeks, we have no vaccine mandates in this country. It was a blatant lie. Did you do anything to stop him lying?
Senator, I can't comment on what the former Prime Minister, I know, supported vaccine mandates in aged care and disability. That was very much a National Cabinet position because of the high vulnerability of the residents and the workforce in those settings. I don't believe National Cabinet took a community-wide mandate approach, but various agencies, state and territory, Commonwealth and private sector agencies made their own decisions about that. But I don't think it's fair to say that the TGA has been promoting vaccine mandates. It's not their remit and they've never done it.
Did you do anything to stop it?
Thank you, Professor Murphy. Senator Roberts, I do need to share the call. Are you able to place the remainder of your questions on notice at this point?